And so you have some options. With regenerative medicine, you have some options. There's adipose stem cells, there's bone marrow stem cells. Anybody hear of those? Yeah. Adipose stem cells is from your fat. You take a nice big needle and stick it in and suck it out. Bone marrow stem cells, they drill a hole in your pelvis, and then they suck it out. And you have those. Everybody has those. Then there's the amniotic umbilical cord tissue. Anybody hear of that? Mesenchymal stem cells? Okay, so we're clear on how this hit. A healthy mom goes in for a scheduled C-section, not an abortion, not a emergency C-section either. A healthy mom goes in for a scheduled C-section, and they ask her if she would like to donate the cord. Now, the umbilical cord is not the mom, and it's not the baby. It's neither one. So it's not a human being, by the way. And so they, through FDA-approved guidelines, they process this. They test the mom, they test the baby, make sure everybody's healthy and copacetic, there's no diseases. So it goes through a long, drawn-out process for that. That's how that's done. Anybody hear of something called exosomes? A growth factor? Nobody? Okay. So, how do stem cells, how does regenerative medicine actually work? And when I ask people, they might, and who's, anybody here been to other seminars for this? No? Well, I talk to people who go to seminars, I talk to people who read all this stuff, they really don't have a clue. It's pretty simple. Gloria, I'm going to use you again, okay? Alright, so Gloria's out on the boat. It's a nice summer day, not like the wintertime where she's out on an ice shanty. She's out on a boat, she's rested, she's relaxing, and she looks around on the shore, and there's the Coast Guard. And they're ignoring her. They're just, Vicky, they're really happy. Gloria's not saying anything, she's not yelling for help. We can ignore Gloria. But Gloria, boom, she falls down, she hits her knee. And pain causes what?
Inflammation.
Inflammation. Okay, now inflammation is producing cytokines. And cytokines attract your stem cells. And your stem cells come to the rescue. And what they do is they send a signal flare down into the boat. And that lights up the boat. That signal flare is called an exosome. And that signals the osteoblasts, the chondrocytes in your knee, in your shoulder, the Coast Guard, to go to work and heal your body. Regenerative medicine, your stem cells, umbilical cord stem cells, they do not heal you, they do not become you. They signal you to heal. So they signal your body to repair, restore, regenerate, or replace broken down tissue. They don't become you. They just signal you to heal. The signal is the most important part of it. The signal is an exosome. And that's very important information. So let's talk about your stem cells. Jack, I'm going to use you an example, okay? All right, so Jack's, he's a 10-pound little baby, cute kid. He has 35 million stem cells. That's a lot of stem cells per capita of a 10-pound kid, right? And so Jack's learning how to walk. Why does he need so many stem cells? Because he's going to fall down about 18 times that day. And he's going to hurt his knee, and that's going to cause pain. It's going to cause inflammation. That's going to trigger his stem cells. The stem cells, they're pretty fresh. They haven't really been doing anything because they're fresh. And they go to work and they signal his osteoblasts, his chondrocytes to heal his knee that he just fell down on. Right? Dr. Moore is 55 years old. How old do you think my stem cells are? 65. 55. Thank you. Yes, they're 55. However, I don't have 35 million stem cells anymore. I have 17.5 million stem cells. And my stem cells at 55, they're not really jumping around too much. Because I did my best to beat the heck out of those things. And I beat them up. And they're 55 years old. And there's not that many of them. At 80, you have 3.5 million. You want to know why you don't heal like you did when you were younger? Is you don't have the signals. You're not signaling your body to heal. You have a good amount of chondrocytes and osteoblasts that make new bone and new cartilage. You have a really good amount of that. You're just not signaling them. That's the problem. And so how does your body heal? The healing response is real simple. When you get pain, you get inflammation. That signals the stem cells. And what the stem cells will do, your stem cells, they will cause you to reduce inflammation that reduces pain. Sound good? They'll also stop your body from degenerating more. Stop the cellular death called apoptosis. And they will stimulate your body to make more bone, muscle, bone, cartilage, and fat, and to make more stem cells. And that's what you do when you're working properly. Now, if your shoulder only goes up that high, you're still going to have pain, you're going to have inflammation, but you have dysfunction. So this is blocked when you're taking those anti-inflammatory drugs, when you're taking painkillers. Kiss that goodbye. And that's why people get chronic problems, because dysfunction and lack of knowledge of how to take care of themselves. You got to work properly to heal properly. And so people have questions. Okay, Dr. Moore, let's get to the nitty-gritty. Is this going to hurt? Russ, he was on the video. He likes to come to all the workshops to do a testimony. Did it hurt?
No.
Did you even feel it?
No.
You didn't feel it. The needles are so small, you don't even feel them. If you have your blood drawn, it's way smaller than that needle. The needles are very small, you don't feel it, doesn't hurt. And then, how long does it take to feel better? The books tell me to tell you 4 to 6 weeks. Russ was 3 weeks. Some people are 3 months when they finally admit that they feel better. Some people the next week. Everybody's different. And that's the key thing. Everybody's different. And then, how long has this been around? Regenerative medicine has been in the works for 25 years. And if you go and you read the history books, you'll see it's actually been around for a long, long time. For 25 years when the science started. And then, will I have a reaction? Am I allergic to this stuff? Umbilical cord stem cells are primitive cells. They don't have those blood-borne factors. And so no, there's no reaction. And the exosomes, they're not even cells, they're just cell particles, and they're sterile filtered. So there's no reactions. Is this from embryos? I want to double clear this up. It is from umbilical cord tissue. Umbilical cord tissue is not the mom, it's not the baby, it's not from aborted fetuses, it's not from vaginal birth, it's not from an emergency birth. It's a scheduled C-section. And then how many treatments will I need? What I find out is, the people that have been to other seminars, they hear variable numbers. The numbers should be 1 injection. That's it. That's all you should need. Because if you're working properly, you will keep on healing. Just like that slide said, you replicate that tissue, and you keep on healing like ogres, like onions. You build that up. Now, you get in a car accident, something tragic happens that can change everything. All bets are off. Because that's how most people get messed up in the first place. And you're in a poor lifestyle and dysfunction. And so, the last question is the most important question you want to ask. What happens next? That's the most important question. And what typically happens, and I found this out through experience, when I talked to this guy, he had injections in both his knees 6 months before I met him. And I'm going to tell you, it was umbilical cord tissue, I think from this company. We're not the only people around that use these guys. We believe they're the best. Some people use cheaper ones, some people are trying to save a buck or something, but we don't do that. We use those guys. And the same stuff. And I said, so what did they do to follow up with you? He said, well, 3 months after my injection, they took x-rays and a ultrasound. I said, okay, what did they do? Did they do anything else? He says, oh yeah, 6 months, they took x-rays and ultrasound. And I said, so what did they do to make sure you were healing? And he said, what did they make sure? He got mad. And he said, you know what? They didn't do anything to make sure I'm healing. They were just checking to see what I'm doing. Some people will say, well, here's what we're going to do. Is we're going to take some of your blood, we're going to spin it down, we're going to get some of the good stuff out of your blood, 55-year-old blood, not 1-year-old blood, 55-year-old blood, and we're going to inject it back in there, and that's going to be like fertilizer to the stem cells, because it's full of your nutrients. That's called platelet-rich plasma, which is interesting, but it still isn't doing anything to make sure you're healing, because you still have the dysfunction, and if you have limited function, you will have limited healing. It is a fact. Anybody agree with me on that?
Yeah.
You have to function properly. If you don't function properly, you will not heal properly. It's very simple. And so, in our office, what makes us different is we restore the function. And you gotta watch this to understand it. Let's see you put your arms up, palms down, and lift them up as far as you can comfortably. So you're getting on the left shoulder because the right one's going up pretty high, right?
Yeah.
Got it. Okay, put your arms down. Now if we can help you out and get that shoulder up higher, what would that do for you?
That'd be great.
You great? I'm great. You ready?
Yeah.
Okay, so we got that done. How long do you think that took?
5 minutes.
Okay. And how does your shoulder feel?
Feels pretty good right now.
What does it feel like?
It feels like I can move it again.
Feels like you're moving again. Okay, you ready to show everybody how you can move it? That's pretty darn good, right?
Yeah.
Okay. And that's without pain?
Yep, pretty much. A little bit, but not really what it was.
Not like it was. So what percentage improvement would you give that?
Probably 90%.
90% improvement from one time.
Yeah.
Okay, and you're scheduled for surgery.
Yep.
And so what does that make you think?
Makes me think again about surgery.
You need to be that guy, not this guy. Now I'm going to let you know this. He never got an injection. He didn't need it. He just needed to work better. You don't have to get the injection. Some people are way beat up. It does help, makes a difference. But if you're way beat up, but if you're not so beat up, you don't need that. If you have a fake knee, you can't get an injection in a fake knee because we can't teach your body how to heal metal or plastic. But we can get that knee to work better, fake or not, which is surprising to me. Because we'll do this on fake stuff and it works better.
He didn't have any injections?
He had what I do. Reset the way the brain sees the body. That's what he had. And so, we have something called our Restore Your Health program. To restore your body to work better. And the first thing we need to do is find out how we can best serve you. We need to find out, are you a good candidate for care? We need to find out everything we can about you to see if we can do that. And if we can, then we work on restoring proper function. To get everything working properly. Because that's how you're getting healed. And then we have to balance it out. What people don't notice about this is that arm actually works better. That arm's working better. We never touched it. But if you see his head, he's like this when he does it. That's still not right. So we've got to balance that out so we can do that without this deal here. So we've got to balance out other body parts. Because what good is it if your knee's working good, yet your hips all screwed up?
Yeah.
It's not any good. And then, once we restore balance, now we work on restoring the tissue, the broken down shoulder, if it needs it. People didn't know there's options. And you want those options.